Devon here again from Absolute Injury Management, Gippsland's Exercise and Sports Medicine Centre, and we've had a bit of a run in the last week of shoulder pain patients coming into the clinic. So I thought I'd just do a video about the 3 biggest mistakes that people make in the gym when it comes to shoulder pain. So number 1 is about a poorly balanced program. So when we say poorly balanced, generally in a gym program or in a training load, we want to make sure we have some balance between chest dominant exercises and back dominant exercises. Now, if we get too chest dominant, and this is what tends to happen because of lack of equipment, group exercise programs, people tend to get too rounded in the shoulders because there's so many chest dominant exercises, and they get rounded, which causes impingement when they go to move their arm above their head. So what we need to get those people to work on is to make sure that they're working on their back as well, because that will change their posture and then open the shoulder joint up. So poorly balanced programs is number 1. Number 2 is that they have poor form and technique. And again, that relates back to posture. If someone has poor form and technique, generally they're a bit rounded in the shoulders. Think of someone doing like a side lateral raise or a shoulder press. If they do that when they're rounded in the shoulders, again, they're just going to feed that impingement cycle and they're going to get shoulder pain. And number 3 comes back to not taking action or not changing their training load when they do have shoulder pain. When you get shoulder pain, you need to act fast. You can't let it get on top of itself, otherwise it will cycle and the impingement will just continue on and on and on. And shoulder pain can be pretty debilitating. So if it becomes quite serious and quite significant, then you can have to undergo techniques such as injections or even surgery if you don't pick up and get your shoulder pain looked at early. So certainly that's a big tip we'll give to people. If you have shoulder pain, attack it right now. Don't leave it till it's too late. Make sure you get it assessed and make sure you get a treatment plan around that shoulder pain, and talk to us about changing your training load so that it doesn't become a more chronic condition. So you can do that by calling the clinic here on 5174-7250, or you can book online at absoluteim.com.au. See ya.